And so I'll have folks come in and be like, I've been on the job for 30 years. Now I have these moments where I'm just breaking down crying. I can taste blood in my sleep. What's wrong with me? Have you ever gone to therapy? Have you ever learned about post traumatic stress? Have you ever learned about the impact that trauma and stress has neurobiologically on your brain? No. I think there's something wrong with me though. Now I'm like, this is a normal reaction to 30 years on the job if you've not really ever done anything.
Mhm.
Just like you'd say to I always say, professional athlete. If you talk to a professional athlete and they said, I've been on this job, doing this job for 25 years. I've never done any PT. I've never learned about rehab. I've never done any of that. And my body's hurting. What's wrong with me? We'd be like, well, you're a professional athlete. Like this is kind of what happens after 25 years, especially if you haven't like really kind of done proactive things to mitigate some of this. So that's what I see the most in the first responder world is that a lot of people don't have just baseline information about mental health, the science behind the brain and what happens with trauma and stress. And it's not to say, oh, you're going to have PTSD. That's absolutely not it. It's about just like, this is normal stuff. We need to normalize it and get that information out because when they have the information, they're able to kind of notice, man, I'm feeling really extra jumpy after the shifts this week. There's a couple of bad calls. Like, what can I do to kind of make sure I get my baseline back? Right. Instead of waiting 20 years to do it.
Yeah. Yeah, I also feel like too, I see that, but I also see sometimes people are so afraid of what it means to have PTSD that they just avoid it with all like, what would you say? Like, all whatever possible. So they're just like constantly trying to avoid getting that label. But for me, the big thing that I try to kind of focus in on with people is you don't have to have PTSD forever, right? Like it's not a lifelong diagnosis. If you do therapy and you do the work and all those things, you can get out of meeting criteria for PTSD, right? And so you can essentially do things to recover. And, it's the way that I kind of try to tell people. So it's not this like, you're stuck with it forever kind of thing. You can recover from PTSD. You can no longer meet criteria for PTSD. And I find that once people realize that a little bit too, they're a little bit more open to acknowledging, okay, maybe I do have some post traumatic stress stuff going on now that I know that I don't have to be diagnosed with PTSD for the
Yeah.
rest of my life kind of thing.
Yeah, that's a great point. Is that it's if someone is at the point where they have post traumatic stress disorder, which is just another word for clinically significant symptoms of post traumatic stress, meaning they're chronic, they're severe, they're causing a lot of problems in someone's life. If someone is at that point, it's not permanent, right? Neuroplasticity of the brain. And then along with that, Robin, too, I would say is that I find a lot of first responders, like you said, it's almost like this avoidance. So if they notice any normative symptoms of acute stress or post traumatic stress, not all post traumatic stress is post traumatic stress disorder, right? Meaning
Right.
like we,
Exactly.
we don't want to pathologize normal human reactions. Now, it doesn't mean we want to avoid it and let it sit and put our head in the ground like an ostrich for many years, but it means that, okay, I'm experiencing this. I know why, I know what's going on. What do I need to do so that I can help mitigate this before it,
Mhm.
turns into the D at the end,
Yeah.
right?
Yeah. I talk to people too, especially when I do presentations on PTSD. I do a lot of education on peritraumatic stress and how normal that is. And, most of the time it does subside within 2 weeks if you let those natural emotions and those natural reactions like have their space to do that. It's when we avoid, right? And when we kind of try to avoid all of those things that we kind of are setting ourselves up more than not, right? But yeah, there is peritraumatic stuff that is going to come up very normal. And I always tell people too, it's normal reactions to abnormal circumstances, right?